If you're over 60, you've probably been told for years that taking vitamins every morning is one of the smartest things you can do for your health. Something for bones, something for the heart, maybe something for energy. But here's the truth many seniors never hear. Some of the most common supplements can quietly work against you. As we age, the liver and kidneys clear excess more slowly, and nerves and blood vessels become more fragile. So what seemed healthy at 40 can become a silent problem at 65. In the next few minutes, you'll learn 4 supplements to be careful with after 60 and 4 that often support strength, balance, and clearer thinking. Stay to the end because the final one is linked with a significantly lower risk of early death in a large long-term analysis. Worst number 4 is vitamin A in the retinol form. Vitamin A matters, but retinol is fat-soluble, which means it can accumulate when you take it daily from multivitamins or liver-based supplements. Too much can trigger aging-like symptoms: dry skin, headaches, dizziness, joint aches, and constant fatigue, and chronic excess can be toxic. A safer approach is to avoid high-dose retinol and get vitamin A through beta-carotene foods like carrots, sweet potatoes, and leafy greens, because your body converts only what it needs. Worst number 3 is iron supplements, unless a deficiency is confirmed. In later life, most people aren't losing iron regularly, so extra iron can build up and add stress to the body over time. The symptoms can be vague and easy to dismiss. The solution is practical. Check your labels, choose an iron-free senior multivitamin, and ask your clinician to confirm iron status with blood tests before you supplement. Worst number 2 is standalone calcium pills. Calcium is important, but big supplement doses may not go where you want, and some research has raised concerns about calcium deposits in blood vessels. If you truly need supplementation, don't take calcium alone. Vitamin D3 supports absorption, vitamin K2 helps guide calcium toward bones, and magnesium helps keep calcium balanced. Better yet, prioritize food sources like yogurt, sardines with bones, leafy greens, almonds, and chia seeds, and keep doing weight-bearing movement. Worst number 1 is high-dose vitamin B6. B6 is essential, but long-term high doses have been linked to nerve toxicity, with symptoms that look like normal aging: tingling, numbness, burning sensations, poor balance, and falls. The dosage trap happens because B6 shows up in many nerve and energy formulas, plus your multivitamin, so the total climbs without you noticing. The fix is to read the label, avoid megadoses, and rely on food sources unless your clinician tells you otherwise. If you feel new tingling or burning, stop high-dose B6 and get checked. Now the 4 nutrients many seniors benefit from. Best number 4 is magnesium. It supports muscle relaxation, sleep, nerve signaling, and a steady heartbeat, and many older adults run low. If you supplement, forms like magnesium glycinate, citrate, or malate are often easier on the stomach than oxide, and foods like beans, nuts, pumpkin seeds, and leafy greens help too. Best number 3 is vitamin D3. After 60, your skin makes less from sunlight, and low levels are linked to weak muscles and more falls. D3 also helps your body use calcium properly. Take it with a meal that includes healthy fats for better absorption. Best number 2 is vitamin B12. Absorption drops with age, and certain common medicines can make it worse. Low B12 can look like aging, fatigue, memory slips, numbness, and unsteady walking. So testing helps, and supplements, including sublingual forms, can be useful. And best number 1 is omega-3 fatty acids, especially EPA and DHA. These fats help calm chronic inflammation that drives stiff joints, stiff arteries, and faster brain aging. In a pooled analysis of 17 long-term studies, people with higher blood levels of marine omega-3s had a lower risk of death from all causes than those with the lowest levels. Aim for fatty fish a few times per week, or use a quality supplement that provides combined EPA and DHA. So here's the takeaway. After 60, the goal isn't more pills, it's smarter choices. Tonight, check your supplement labels. If you see high-dose retinol, added iron without a diagnosis, big standalone calcium, or high-dose B6, rethink them. Then focus on what often helps most: magnesium, D3, B12, and omega-3s, guided by testing and medical advice when needed. If this helped, follow senior health tips for more clear, practical guidance that helps you stay stronger for longer.